good afternoon. I'm Dr. Francois, CEO of Lowee. This afternoon I'd like to talk to you about the causes of pressure injuries and also how to prevent pressure injuries. So, in the first place, there is three main factors that lead to the development of pressure injuries. And those three main things are, in the first place, pressure. So if you have a patient that is immobile and they lie in one specific position for too long a period, then the pressure on the skin might be to such an extent that it occludes the microvasculature of the skin. Anytime that you have pressure above 30 millimeters mercury, you will occlude the microvasculature. This you can see if you press on your hand and you lift your fingers and you see the white area. If that area turns red again, it's just a reperfusion. The second aspect is the microclimate. If your skin becomes wet, so it can become wet if you lay and sweat. Also, it can become wet if the patient is incontinent. In that case, because the skin is wet, the skin are macerated and this leads to skin breakdown. The third aspect is shear forces. Now, to explain shear forces, it's basically a sideways pressure on the skin. This sideways pressure can lead to damage of tissue and also to the occlusion of microvasculature. There is also other factors that contribute to the development of pressure injuries. One of them is poor nutrition or dehydration, and then additionally to that, factors that influence your microvasculature such as diabetes, hypertension and high cholesterol will all contribute to poor circulation in also then the microvasculature. Finally, something else to consider is your patient's cognitive abilities. If we have a patient that is cognitively impaired, who has some form of dementia, that will definitely also be a risk factor. Now, let's switch over to how to prevent pressure injuries. Essentially, we want to address all the factors I've just mentioned. So let's first start with the concept of reducing pressure and therefore ensuring a regular reperfusion of the skin. Firstly, if you are able to turn the patient regularly and you're able to turn the patient every 2 hours, that will go a long way to ensure constant perfusion of the skin. But that might be impractical, and therefore using certain devices that can redistribute your pressure better will help you a lot. In which case, products like the product range of Care of Sweden and the pressure redistribution mattresses will help you a lot. Secondly, you want to attend to the microclimate. In this case, you want to ensure that the patient, if the patient is incontinent, are dried regularly. Also, you want to prevent the patient from sweating. Thirdly, when it comes to shearing, this is very important to simply take very good care when handling a patient. Never handle a patient rough. And also never pull a patient on their limbs to change their position. The best thing to do is to use a draw sheet. A draw sheet is a sheet that you put over your mattress. First of all, you have your normal covering, your normal sheet on your mattress. Then your draw sheet comes in between the patient's body and the normal sheet. The idea of the draw sheet is that the caregivers actually use the draw sheet to lift the patient and to move the patient. Then you want to attend to the other factors that I mentioned, such as ensuring good nutrition and hydration. Also attending to comorbidities, like I mentioned, hypertension, diabetes and high cholesterol. And essentially being very attentive to the patient's cognitive abilities. This concludes my little tutorial on causes and prevention of pressure injuries. I'd like to end by saying, remember, Lowee cares by offering a free healthcare system strengthening project for your facility. We connect the people of Africa with the best quality mattresses from the Care of Sweden product range, and we do all of this to make sure that the people of Africa thrive. And finally, remember you can visit us at www.lowee.co.za. Thank you.